Hello, my name is Zehra Patail, and I chose smoking as my public health presentation topic. Before I begin, I want to clarify that I mean smoking tobacco specifically. So what is the problem? Well, today in America, 15% of people still smoke, even though around the world, half of the people who do smoke end up dying. And that number comes out to around 7 million every year. I want to point out that 80% of the world's smokers belong to low or middle income neighborhoods, and this is really important because it's important to understand that people who have lack of education on the health risks of smoking partake in it more, and unfortunately, education in low or middle income neighborhoods often lacks. So, how did this problem happen? Well, chewing tobacco was always a thing amongst Native Americans, but when the Europeans came here, they introduced tobacco smoking, and since then it's grown into a huge industry that has become of large economic profit and importance money-wise. So how do people get addicted? Well, the nicotine component of cigarettes is the most addictive part because it increases your dopamine and serotonin levels, and this causes pleasure, and that pleasure makes you want it more, and so when you want it more, you smoke it more, which increases your tolerance, so you're less affected by the nicotine, and then you want more, so you smoke more, and then you're more dependent on the nicotine as well. So it's really a very awful cycle. And then when you try and quit, withdrawals such as anger, sleeplessness, and anxiety, they can deter you from quitting because you want to go back to avoid these symptoms. And then, where is smoking most prominent in the world? Well, China, Russia, and America have shown to be the leading smokers or smoking countries, China especially. It says here on the graph that they have smoked more than the next top 29 cigarette consuming countries combined, so that's a lot of tobacco. And then why is this so bad? Well, smoking puts you at risk for coronary heart disease, lung cancer, stroke, and other cancers. And in addition to that, when you smoke, you expose other people around you to it as well. And so your children or your loved ones or your co-workers are exposed to these risks as well. And I also have a picture comparing the lungs of a healthy human to the lungs of a tobacco user. And as you can see, it's very detrimental to the health of your lungs. So what are etiological factors that make people smoke? Well, there's social settings. So if your parents, your siblings, or your friends smoke, then you might think it's okay to as well, and then you partake in it. And then it's also been proven that genetically you are more inclined to smoke if certain environmental factors are there. And then having a mental illness or being an HIV or AIDS patient, that also means you're more inclined to smoke. In addition, media has often portrayed cigarettes as fashionable, such as in the picture with Angelina Jolie and Leonardo DiCaprio, who are people everyone looks up to and wants to be, and because they're smoking, other people want to smoke as well. So how do we solve this problem? Well, clinical intervention is very important because people are more likely to listen to their doctors, so educating patients on risks is very important. In addition, educating children at a young age can prevent the use of tobacco later on. And one policy solution to the problem is increasing tax on tobacco products and then using the revenue towards anti-tobacco campaigns. And an example of that could be the California Tobacco Control Program. And what this program did was they increased the tax on tobacco, and they used the money for ads, education, and limiting tobacco industries by making them write the risk on the packaging and stuff like that. And then another really good example is the Philippine Executive Order 26, and that basically just banned smoking in all public places, which is really important for a developing country such as the Philippines. So it's really important to think about how we're going to prevent this problem in the future. Public health research has pointed to examples that I've talked about before, such as increasing prices, anti-smoking ads, policies, education, and limiting the tobacco industry. But in my opinion, I think it's really important that socially we make smoking taboo the way we do, doing heroin or cocaine, because it's honestly just as detrimental. And I think that this would prevent future generations from smoking if, current generations begin to see that tobacco is just as detrimental as other horrible, horrible drugs. And then finally, I have my references, and that's the end of my presentation. Thank you so much for listening.